Tonight, we're taking a closer look into a disease that saw its first American outbreak just a little south of us. Warren County, Ohio, which is in the Cincinnati area, reported 145 cases of pneumonia in children ages 3 to 14, and that's since August. So far, officials say there have been no deaths or no evidence of increased severity. The outbreak comes as respiratory illness cases are going up this winter. Here to talk with us more about everything that we are seeing is Dr. Amesh Adalja. Thank you for being here with us. He is an infectious disease expert from Johns Hopkins University.
Thanks for having me.
Glad to have you. So, Dr. Adalja, as far as what we are seeing right now, this is obviously something that has a lot of people concerned. Is there reason for that concern, or is this just something that is happening and we don't need to be too worried?
I don't think we need to be too worried. When you look at what's happening in Warren County, Ohio, and what's happening in other parts of the world, what you're seeing is an uptick in pediatric pneumonia cases that are caused by known organisms that infect us every year. So viruses like COVID, influenza, RSV, rhinovirus, bacteria like mycoplasma, things that are ordinary infectious diseases. And it's just that we're in respiratory season right now, and these things are all coming back. And there has been some time that people haven't been interacting. So some of the immunity, for example, to mycoplasma may be lower than it had been in the past. And that's what's occurring right now. But there's no more severity to it. There's nothing unusual about this. This is sort of par for the course during respiratory virus season.
Okay, and we know that this is something that is, something that we see this time of year, but specifically with children involved, is there a reason for that?
Well, children do get respiratory infections more frequently than adults, and we know that children have less immunity to these infections. And they especially have less immunity because for the last 3 years or so, there's been diminished social interaction. Although last year we did see rises of RSV and influenza as children socially interacted. But for example, some of these pathogens, like mycoplasma, have 3-year cycles or so. So there's a lot of people that are susceptible, a lot of children that are susceptible that have never had their first experiences with these viruses. So that's why this is hitting children. It just has to do with what bacteria, what viruses they've been exposed to. And for the COVID-19 pandemic, there's a whole cohort of children who just didn't have that experience because they were socially distant.
Now, in terms of exposure, let's talk about precautions that people can take.
So the biggest precaution to remember is, number one, influenza is one of the major pathogens that's behind a lot of this. And we have influenza vaccines. People should be taking advantage of the influenza vaccines. People that are high risk need to be making sure their COVID vaccines are up to date. And children should at least have gotten the first series of COVID vaccines. There's an RSV vaccine for older adults, an RSV vaccine for pregnant women, and an RSV antibody for infants. All of those things can be used. And then you have to think about when you're in crowded, congregated places, think about wearing a mask, especially if you have any high-risk condition. If you're sick, stay home. Or if your kids are sick, keep them home, because that's how these things spread.
Yeah, and that's especially the case right now with the holidays around. A lot of people are meeting and gathering. So this is something that should be top of mind for a lot of families, right?
Right. When we know that when people socially interact, the inevitable result is viruses, bacteria pass from one person to another. We've just come off the Thanksgiving holiday. People interacted from all over the country, and we're going on to the Christmas holiday where people are going to do the same thing again. So when you're in those situations, you just have to assume that while you're gathering with your family and friends, you're also gathering with the viruses and bacteria that they brought with them. So be mindful of that. And if you're sick, stay home. Wash your hands a lot and try and avoid people if you're coughing, sneezing. Make sure you're wearing a mask if you're going to be out around people.
Are we seeing an influx of people in the hospital? Are those hospitals being inundated with patients because of these issues right now?
Not really. We're not seeing a major pressure on hospitals in terms of capacity. Nothing like the bad old days of COVID. But remember, pediatric hospitals don't have as much capacity as adult hospitals, so it doesn't take a lot for them to get into trouble. Last year around this time, they were getting inundated with RSV cases, and that was causing them to have pressure on beds. We're not seeing that yet, but it is important to keep that in mind because pediatric hospitals just don't have the ability to ramp up the way adult hospitals can, and they don't have as many ICU beds to begin with.
Yeah, definitely positive that we are not reporting any deaths right now. But in terms of pediatric pneumonia, how does this differ from other respiratory illnesses?
Well, pediatric pneumonia is sort of a generic catch-all term. It can be caused by a whole host of things. It's just a clinical condition, so it can be caused by influenza, it could be caused by COVID, it could be caused by a bacteria, it could be caused by rhinoviruses, RSV. What it means is that they're seeing children who show up at an emergency department, show up at an urgent care, and they do a chest x-ray, and that chest x-ray shows evidence of pneumonia in the lungs. Oftentimes, you don't get a particular diagnosis, so they say this is a pediatric pneumonia case. And other cases like pediatric influenza or pediatric COVID get classified differently. But that's what's happening, is that the lungs are getting infected by these pathogens, which occurs. This is a known complication of some of these respiratory infections. And it's a rare complication. It's not something that happens in every person. But the fact is, they're noticing it. And this is the beginning of respiratory virus season, and it's expected.
Okay, lastly, I want to ask you, when do parents need to know to take their child to the doctor to be seen?
So if your child has an unremitting fever that you can't control with Tylenol or ibuprofen, if they become short of breath, where they're wheezing, grunting, looking like they're really working to breathe, if they're very sleepy, they can't go about their actual daily activities, if they've got severe vomiting, can't keep anything down, or if they're immunocompromised and they get fevers or any kind of sickness, they should all be seen by a provider as soon as possible.
All right, an important conversation with Dr. Amesh Adalja, infectious disease expert from Johns Hopkins University. Thank you for your time.
Thanks.